Welcome everyone to this chapter Fluorescence technique. The fluorescence technique for fusion microdome rapid training force and concentration crystallized compound step operation timing work troubleshooting cleaning maintenance training fluorescence section for rapid diagnosis. Introduction fluorescence section of pathological laboratory procedure performed the rapid microscopy analysis pigment. Rapid examination techniques of Crossword section. They use the rabbit to prepare the slide from tissue microscopy interpretation. Examination specific type of biopsy procedure that allowed the surgeon establish rabbit diagnosis suspicious match-up during the surgery. Name for the procedure Krakow section. The specific tissues of quickly frozen cut-off microtome and staining immediately rabbit diagnosis for possibly malignant relation. Fluorescence section. The fluorescence section pathology technique provides the immediate microscopy diagnosis during surgery, typically within 10 to 15 minutes. Fusion to minus 20 degrees C to minus 30 degrees C threshold pathological quickly evaluated tumor malignant confirmed disease, identify disease, guide immediate surgical decision preventing the second operation. From biopsy means the standard highly quality of section of less than 10 minutes. Breast, kidney, brain, lymph node. That 1 minute of biopsy means crystalline contain section of 2 minutes. Previously automatic projection time is 4 minutes. The result of nation tissue that less than 10 minutes included chromium immediate cutting the plus projection and E signing with Presto unit. The technique of fluorescence section, cross-tissue examination, proper communication with surgeon, immediate crystallized signing the intermittent forcing section of control. The fluorescence section, histopathology test. Objective principle rabbit diagnosis, reduction, training, examine pathological principle, presentation to pathological. Material procedure to emptying medium, training, cutting the section, train, examine material photo, microscopic pixel. Result intermediate pathology, malignant infection, negative pathology detective margin to the tumor tree. The usual consultation use the pathway tumor malignant diagnosis section of lesion, the histological primary, paraffin the histological surgeon. Fluorescence section purpose, process, speed of quality, methodological limitation. The purpose of oncology malignant status, identify metastasis, diagnosis now to during the operation. OCD compound of incident usually H intermediate pathology. Paraffin 10 minutes of hours prevent a lower eye critical, making the diagnosis more challenging. Commonly OCD compound of function train off into the solid black. Limitation morphological quality compared to paraffin immediate section. Usage of rabbit pathological diagnosis during the surgery. Research enzyme cytochemistry. Soluble substance of lipid and carbohydrate. Immunofluorescence immunocrystal chemical training. Silver training or particular pathological. Advantage of biopsy. More than nightly diagnosis surgeon often additional sample divided in section of operation. Determine cancer of animated surgery image of removal time. The not cancerous match up allowed removed and the surgery can end. Biopsy help in infer mass removal intended tissue removal which helped in center the surround the border the removed. They allowed the collection of proper sample, further scientific research by pathological ability collaborate to the care the patient. Disadvantage of fluorescent section. The introduced particle lead in the lower quality section compared to FFP tissue. The assessment of cellular tissue artifact. Use of carried and special sign in immunohistochemical study were often necessary different diagnosis. Limited amount of tissue can examination interpretively increase missing lesson suitably of pathological change. Freezing microtomy. Instrument of projector crystal freezer cabinet to keep up tissue and applied sub-zero temperature usually minus 50 degrees C to minus 30 degrees C. The tissue plates at metal check with a fractional microtome. The plate to a fluorescent plate of section of typically 5 mm 10 mm thick. The looking at nitrogen isobendage of carbon dioxide used the rabbit frequency. Typical work. The tissue accumulation small sample tissue. Immediate tissue of the OCD metal thick. Sample is rabbit frequency. Black cutting crystallochromic. Staining usefully analyze it. Rapid Chinese approach and concentration. Rapid Chinese technique of trap humor tackling and using paper training. And various rapid different time. The quickly efficient of non-cartophysical biological sample often within the 4 minutes. The rapid diagnosis particularly surgical, pathological, fluorescence section and histopathology. Fluorescence concentration fluorescence section. Lower fastest of method. Excellent ICF, ISF. Fastest method. The quickly techniques of available that processing. Immunocytochemistry, immunofluorescence, cytoperiodization. The method of section so depending the specific type of tissue type. Concentration porous marbological, proven freezing article metapnapsation, bore marbological after lower structural title impaired to the method like the paraffin imitation. The freeze highly susceptible damage from high crystal formation recorded snap minutes of tick. The crystal compounded step of operation to maintain for tuberculosis or cleaning maintenance. Cytosite speculated collaborative instrument uses freezing sample, cut them to ultra-thin section, typically by cytological and immunohistochemistry. How a free freezer camper can live operation 20 minus 20 degrees to minus 30 degrees C. Function simulation laboratory instrument the disintegrate freezing the sample at cut ultra-thin section. The microtome with house at a free freezer camper. General operation temperature between 20 degrees Celsius. Social immunohistochemistry enabling microscopy examination tissue. Key component. Resource compare cabinet. Instrument sign in the refrigeration system. Microtome previous instrument is clean. Handle located inside a camper used the operation microtome. Pigment chip folder. Folder frozen pigment flag OCD compound. Knife-bladed folder hold disably bladed retinal glove. Hand roll include blade inside the section to not cool. Rabbit freezing keep colder section for quickly fresh tissue. Flywheel handle look safety mechanism look the plate. Setup procedure. Preparation allowed the reach of target temperature freezing overnight reach 8 hours first optimally. Look handle remove hold black inside the camper clean. The tissue ground quickly freezing using the extractor for faster cooling. Installing plate carefully insert disposal plate into the holder. Adjusting angle 5 degree 10 degree standard check manufacturer recommended and alkaline and roll plate. Equilibration mounted pigment reach a camper temperature about 10 minutes. To operation, trimming and forward plate of cutting the thickness 10-30 mm. OCD rough filled in the tissue exposed. Fine section. Slowly handle about for carefully bulk roll in the butts. Pick up the single section, hold in the warm microscope, slide near the section. Trim knitting work. Daily instrument, the lock, handle, removal blade, cleanup, source, Campbell, clean tools. Troubleshooting section chloride laying and section fragment, cutter the section mark and attachment execute formation. A cleaner maintains daily, weekly diffusion lubricant drying. Usually at the duct removing having the glass shocked with ethanol and reducing convert. The performed cleaner the camper removing washing weekly. Diffuse cleaning regularly, weekly or monthly prevent the heavy build-up. The moving the part especially crucial advantage cleaner the per manual. The camper completely switching the avoiding damage of mechanism. The tiny fluorescent section rabbit diagnosis. Rabbit diagnosis techniques of surgical pathology is established during the quickly result. The most common method of usually rabbit chemodialysis estrogen staining. Forces involving rabbit freezing and cutting the tumor, quickly staining the imprinting examination. Used tumor diagnosis, checking the surgical marking, identify tissues are typical during the surgery. Rabbit section of staining protocol, fixation, ring staining, dilatation, clearing, cover clipping. 95 fixation ethanol formalin, tap water 5 to 6 second rinse, hematite staining, rinse lithium carbonate, using 20 to 20 second staining cytoplasm, 95 alcohol, 100 alcohol, saline suspension, apply mountain medium cover clip. The conventional fluorescent section projector, fluorescent pattern sample, one routine HE patient tissue, intraoperative HE diagnostics, FFRE HIC controlled tissue, patient tissue. D fluorescent patient sample, evaluation of FFRI HC quality controlled tissue. Routine PP, interpipette of diagnostic chain, routine the ICG with controlled tissue, patient tissue, final FFPE diagnosis. Alternative special train. Tolerant blue, diabetic cystochrometry, oil red O. Tolerant blue, very diabetic alternative and used used the identific cells for quick nuclear evaluation have taken only few nights. Rapid immunocytochemistry. The use of segregation pigment marker cytokeratin oil rabbit identified disease sample.